Hello and welcome to the Armor Men's Health Hour. I'm Dr. Mystery, your host, as always, joined by my technologically capable and awesome always co-host and business office manager in my office, Donna Lee.
That's right. If you're a regular listener, you know that he's being sarcastic, and I don't know what the hell I'm doing.
I'm just amazed that we can get this show out.
Me too. You're welcome.
Many thanks to Kelly and the KLBJ News Radio staff for helping us overcome some of our deficiencies.
That's right. Thanks for listening, everybody.
This is a men's health show. This is brought to you by NAU Urology Specialists, the urology group that I started in 2007. We are up to 4 physicians. We have 5 advanced practice providers. We have 2 pelvic floor physical therapists. We have nutrition. We have a supplement line. We have everything that you need for your men's health needs. And most importantly, a very important commitment, deep commitment to your holistic care. Donna, where do people get a hold of us and how do people become our patients?
That's right. You can reach out to find out more about holistic urology and our awesomeness at 512-238-0762. We're in Round Rock, North Austin, South Austin, and Dripping Springs, Texas. Our website, armormenshealth.com. It couldn't be any easier than that, Dr. Mystery.
Couldn't be any easier.
Armor Men's Health.
We have the real distinct pleasure of having an OG.
An OG?
Yeah.
Our first remote OG.
And he is like one of my professors from when I was a young budding urologist.
That's weird because he looks younger than you do.
That is not nice.
That's cruel.
So we have Dr. Ricardo Gonzalez joining us from Houston Methodist Urology. Ricardo, thank you so much for joining us today.
You bet. It's my pleasure to be here, Sonny.
So, when I met you first, you had done work with women's reconstruction, and in your later kind of now incarnation, I know you most from the treatment of BPH for men.
Yeah, it's an interesting evolution how you get there. So as urologists, we're plumbers, and our job is to help restore urinary function in humans, men or women. And in my training, I trained at Cornell, where our fellowship was in voiding dysfunction of both men and women. And I still practice both, but I think the field that has evolved the most rapidly over the last 2 decades has been in the advancements in treating enlarged prostate and men's urinary symptoms in a way that is less invasive than traditional treatments. So research-wise, my bent over the last 20 years has geared towards restoring men's urinary health in less invasive ways.
I think that has something to do with kind of the men's increasing disdain for side effects when it comes to treatment. Because, in the old days, when you only had one hammer, you would accept all the consequences of kind of taking care of your prostate issues. But as men are becoming more sophisticated and expectations of the healthcare field are becoming increasingly, more lifestyle based, men want it all.
That's right. And before, it was not an option. Every treatment for the prostate, which is an ejaculatory organ. The purpose of that gland is to produce the fluid that transports a sperm. So any treatment, whether it's a pill or a procedure, can affect that function. So as we've come up with techniques and devices that help preserve that function and make it less likely to be affected, then the bar has been raised for treatments to take that into account. So men should be counseled when they're being offered treatments about the vast array of options we have now that don't make them sacrifice sexual function and trying to improve urinary health.
So just to reiterate what you said, the prostate, as an organ really has only a reproductive role for us, but it's centrally located in our pelvis in a way that affects our continence or our ability to hold our urine, as well as our potency, which is kind of our sexual function, and as well as orgasm. Now, when I was in training, this whole idea of affecting a man's big show at the end of the event didn't even occur to us. Like causing retrograde ejaculation was the least important concern. As a matter of fact, it harkens back to one of our favorite jokes. Donna, do you know who wishes had retrograde ejaculation?
Bill Clinton.
And so,
yes.
And I have men that actually, I had one that came and said, I will only do a treatment that causes retrograde ejaculation because my wife's not interested in cleaning up anymore. So
Hallelujah.
So what else, like other side effects of traditional treatments for BPH, surgical treatments, have we been trying to avoid with newer treatments?
Yeah. So because the tube that transports both the semen and the urine is shared, it's a urethra. Problems with the prostate affect both. It can affect ejaculation and cause pain or issues with that, and it can also affect your ability to get the urine out. So to treat the urinary problems, we tend to expand the tube with different techniques to create space to let the urine get out more. And in doing so, you can cause bleeding. Men can get infections. They can get a dry orgasm and things like that are bothersome. But again, as we've advanced with these techniques, there's less risk of that. We're seeing less risk of any, I feel like I talk about loss of urine control or incontinence as a potential risk of these prostate procedures, but really it's not something that we see anymore. Our treatments have gotten so precise that the odds of someone losing control of their urine or having what's called stress incontinence after a BPH procedure should be negligible. It should be.
So, as we look at traditional treatments, we start patients with medication, diet, and supplements. And the traditional medicines that people may know out there are going to be silidocin or Rapaflo, alfuzosin, and tamsulosin is probably still pretty popularly used. But our thinking about continued long-term use of these medications has really changed over the last few years, namely the potential for long-term cognitive dysfunction and balance and blood pressure issues. How do you advise patients and your own new, less than capable trainees that were certainly not as good as I am?
I don't know if any can hold a candle up to you, Dr. Bistri. So what a bar that was set so high.
That's clear. You being a long-term fan of the show, you of course understand the importance of. So how are you advising the newer thoughts when it comes to long-term use of medications?
That's a very good point. Let me use the analogy that I use, and it's not quite the Clinton analogy, but I tell men, let's say you had a brain tumor and it was causing a headache, and you saw a doctor and they told you, hey, go ahead and take a Tylenol once a day, and you're like, hey, after a week you start feeling better, like the headache is better, and so you get on with your life and you forget about it and you're taking a pill every day, and maybe a year later, 2 years later, the headache is starting to come back and you're given another Tylenol. So now you're on 2 Tylenols a day, or maybe 1 Advil and 1 Tylenol, just an example. But you keep just treating the symptoms, but you're not treating the underlying problem. And as we know, after puberty, every year, a man's prostate will grow. So as we're living longer, hopefully, our prostates grow. So if you're taking a medicine that alleviates the symptoms but doesn't get rid of the root cause or treat the root cause, then you can have problems down the road. What kinds of problems? As the prostate grows, it chokes the bladder's ability to empty, and the bladder does more work. And doing that makes the bladder wall stiffer and thicker and less elastic. And that results in frequency and urgency, which means going more often to the bathroom, having to interrupt your activities to get to the bathroom, maybe leaking before getting to the bathroom. And in the most extreme state, you can have urinary retention, where you can't urinate at all, and the urine gets stuck in the bladder. If that's untreated, in addition to pain, it can cause kidney failure and other more severe things.
And so most of the men are going to be kind of coming across, when they can't pee, then they know they have a problem. But really, the symptoms of an enlarged prostate are heralded by slow flow, urinary urgency and frequency, hesitancy when you can't get there. And then, the cardinal ones for me are going to be the development of a bladder stone, the development of recurrent urinary tract infections or blood that you can see.
Yes. Yeah. Those would be the 5 things that, the blood in the urine, the stones, the inability to urinate, kidney failure, and non-response to a medicine are kind of the last of the things that kind of men that require surgery to correct.
So what I want to talk about when we come back from this short break is going to be kind of what are the newest and greatest kind of innovations in surgery for enlarged prostates that have overcome the risks of bleeding, hospitalization, prolonged catheterization, concerns about incontinence, and changes to ejaculatory dysfunction. And a lot of these technologies you've helped to pioneer. Dr. Gonzalez, you operated on my own father, so our listeners need to know that I have a zero love for my father, apparently.
That's not what he thinks.
What is your office number?
It's my office number is 713-441-6455.
And you're located in Houston and what is the name of your practice?
It's Houston Methodist Urology Associates, and we're in the Texas Medical Center, the world's largest medical center.
Right. So make sure you have enough change for parking, everybody. We'll be right back.
That's right. Correct.